Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Judith Borger.
Hello, friends, and welcome to episode 69 of the Aesthetic Doctor Podcast. Today, I'm very honored to have another dermatologist with us to give us insights on psoriasis, a common chronic condition that does not only affect patients' skin, but also has a high impact on quality of life. Our wonderful and very, very knowledgeable expert dermatologist to talk to us about psoriasis is Dr. Julie Letsinger. Dr. Letsinger is a practicing dermatologist at the Palo Alto Medical Foundation. She has a special interest in psoriasis, and she is, in fact, the past associate director of the UCSF Psoriasis Treatment Center. In addition, she is a physician coach who does physician longevity coaching. Before we start with this episode, I would like to add a disclaimer that everything we discuss in this episode is for informational purposes only, unless Dr. Letsinger or I are your actual treating physicians. So please help me in welcoming Dr. Julie Letsinger and enjoy our insightful and informative discussion and education about psoriasis. So thank you so much, Dr. Letsinger, for being here today to talk about psoriasis. I know a lot of the things we talk about on my podcast are really aesthetic medicine, and you are a dermatologist who actually does not practice aesthetics. But I do think that really skin conditions and really conditions anywhere on people's skins are really important to the way people look, the way people feel, and their psychological kind of well-being. So I think it's a really important topic to discuss. So thank you for coming on.
Thank you for having me. And you are correct. I am what we call a medical dermatologist, which means that I don't perform cosmetic procedures, but I definitely know about them. And in dermatology, as you said, most of what we do is very visible. And psoriasis, first of all, I love that disease because there's so much that we can do to treat psoriasis. But it has a huge impact on people's quality of life. And it is really important. It is not considered a cosmetic disease. That's really important to know because it should be covered. It is real. And if anybody ever says to a patient, a friend, a family member, don't worry about it, it's just your skin, that is not true. That is a medical condition. And though it may be visible, it is something that needs to be treated and has a huge impact on the quality of life. Interesting point, we'll go on, but psoriasis has been looked at in terms of that impact on people's quality of life. And it looks like when people are surveyed that having psoriasis can be as big of an impact on quality of life as something like congestive heart failure, diabetes, and kidney disease. So it is just really important to address it.
Absolutely. Let's start from the beginning. I know a lot of us have probably heard the term psoriasis. You might have known somebody to have it. Maybe you're a sufferer out there but why don't you, for our whole audience, describe what psoriasis is and like how it presents?
Yeah. Okay. Psoriasis, first of all, is common. It affects about 3 to 4% of the population across the world, all skin types, all nationalities, all families. In the United States, most of us are aware of psoriasis because we see a lot of advertisements about it. So it is all over television, and it's important to know what it is. We said it affects 3 to 4% of the population. How might you see it? So psoriasis is what we consider to be an immune-related inflammatory disorder. What's that? It's not autoimmune. The body's not attacking the skin, but there is a lot of inflammation at the skin level. And it is something that is both hereditary and environmental. For instance, if your parent has psoriasis, you have about a 10 to 20% chance of having psoriasis. If both parents have psoriasis, maybe 20 to 40% of people have it. But it is super important to know that's not everyone. If your parent has psoriasis, maybe 10 out of 100 people would have it. So not everyone. Okay. There's also an environmental pieces of psoriasis. Interestingly, if you have this genetic tendency to have the disease, there are two times that it most commonly comes out. And that is the late teens, 20s, a time that actually is really difficult for people, right? To be young and high school and college and starting your career and having this disease that might be visible on your face, on your hands, on your scalp. And the other time is later in life, like in late 50s and 60s. And how does it look? The other important thing to know, if you are one of the people that has psoriasis, is that the vast majority of people have what we call mild psoriasis. And that's about two, like if you look at your own palm, the size of your palm, we think is about 1% of your whole surface of the body. That's about two of those. Most people that have psoriasis are not going to have severe psoriasis. They're going to have a few patches, and usually they are these pink, scaly, rough patches on the elbows, on the knees, and sometimes the scalp. But psoriasis can be anywhere. It can be in the genital area, which can really affect people's quality of life, their relationships. It can be on the hands, which can affect shaking hands at work, doing work, if you have cracking on the hands. It can affect the face, but thankfully, that's not as common. Though it can be anywhere, it has certain areas that it likes.
Yeah, I love that. So, yeah, when I think about it, first of all, for those of you who are in the medical profession, what we really talk about most commonly is something called plaque psoriasis, right? Because there's other types of psoriasis that are way less common. And I do think about these chronic, scaly, pink, inflamed like patches. And like you said, that late kind of teen, early 20s, it's when people date, they're trying to establish careers, they're trying to establish relationships, and they obviously want to be seen as desirable, and they don't want to, the average of us doesn't want somebody to be like, oh, what's this? Am I going to catch this? Let's go into that. If you do meet a person that has plaque psoriasis, is it something that's contagious?
Thanks for asking. It is not contagious, not at all. And if 3 to 4% of the population has this, you likely know someone that has it. And it is just oftentimes sitting there on the elbows, maybe the backs of the hands, and it is not something you can catch at all.
And I wanted to just make you make that point so that if the next time you meet somebody, you don't have to worry about it, right? It's not like a staph infection or some transmittable disease. It's their own immune system, like you said, with some hereditary and immunologic factors making them have these patches. But if you sit next to them on the plane, the bus, shake their hand, start a relationship with them, you are not going to catch this.
That is exactly right. What else? What would you like to go now? This is a disease that has, first of all, a huge impact, a lot of treatments, and interestingly, it has some relationships to internal conditions. And for that reason, there are a lot of reasons why I think you should be treated. Actually, before we go there, I have to tell you, one of the reasons I love this disease, and sometimes I'll see patients and they'll say, what are you talking about? I hate this disease, right? It's ruining my life. But one of the reasons that I love it is that we can treat it. It is super important. And if I have a teenager who's in school and is getting teased, or people are avoiding her, or she doesn't want to go on a date because she has lesions on her back, or she won't wear a bathing suit, right? Or shorts. These are super important and impactful things that have a huge impact on quality of life. We can treat that. And for many years, I worked at the Psoriasis Center from 2000 to 2007 in San Francisco. So I've seen a lot of people with this. And for years past, we didn't have such good treatments. And so people with psoriasis and families might not come into the doctor anymore because they'd say, oh, yeah, I know. She's just going to give me some cream and that's it. It's not super effective. And that's not true anymore. So we have a lot of treatments that are more effective that have great safety profiles. So we can
I
help.
love that. I think that's our first PSA, right? If you have psoriasis, it's totally treatable. And especially if maybe right now you're not being perfectly managed or you're not on the appropriate treatments, like dermatologists have the answer. So, seeing that we're talking about treatments, why don't we just go there?
Okay.
And start with what are some of the bigger treatment classes like mild, moderate? Where do we start? I assume with most of the derm stuff, we start with some ointments and some creams for very mild cases.
Yeah, I like to stand back and look at it in a few main categories. So the first category of treatment for psoriasis is the most common, and this is what most people use. And these are called topical treatments. So creams, ointments, gels, liquids. Something really good to know is that we have a lot of options. And if you have psoriasis on your scalp, an ointment is not ideal, right? If it feels like Vaseline, that is not a good treatment for your scalp, right? We want something that you'll use. We have foams that feel like mousse. We have a lot of different medicines that are going to help individual people choose something that they like. And then from there are a lot of different medicines in that category. So the oldest ones are topical cortisones or steroids, and they can be really effective. They can work fast, but we may not just rely on those forever alone. We have other medicines that aren't steroids. Some of those advertised, there are some new ones that are non-steroids that can be really helpful. And some of them we've had a long time. And so your doctor who likes psoriasis is going to be comfortable kind of mixing and matching. If you have just one medicine and that's it, that's all you're offered, and if it doesn't work, too bad, then it's okay. You just need to say, maybe I'll search out someone who really likes this disease and has a lot of options. Okay, so that's topical medicines. And most people, mild psoriasis, you're using that your whole life. And that's fine. We find something that works. Number two is light treatment. This is interesting because as you're listening to the Aesthetic Doctor podcast, most of us are telling you, be careful about the sun, right? Protect your skin from the sun. Interestingly, psoriasis is a condition that responds to what we call phototherapy. And in the United States, oftentimes that's given in a doctor's office. We have units that we can order for you at home. And we're going to choose that in people who can tolerate some ultraviolet light. I'm going to protect your face usually because I want to respect your beauty and not cause discoloration and wrinkling and things like that. But that can be really helpful for psoriasis all over. And there's really no potential side effect of that other than freckling. No, actually, interestingly, we don't see increased skin cancer when we use that as a medical treatment. And then the last big box are internal medicines. And these are for the people who have more psoriasis. So I think about like 10 of those palms. Or either you have a lot of it or it's in an area where it is really making a big impact. So we mentioned hands. If you have visible psoriasis on your hands or psoriasis that's cracking, or if it's on your face and creams aren't doing enough, or the genital area, that's an area where a lot of times I will talking about internal medicines. And I'll take a break and I'm happy to break that category down a little bit more if you want.
I love that. I love that. And just because you called it internal medicine, we're now talking some injections. We're talking a lot of the stuff that we see advertised on TV, right?
There's two main categories there. There are the oral pills and then the shots, okay? And pills come in two flavors. There are older medicines that we've had in dermatology for a long time. And if you're one of these people who's had psoriasis for many years, you may have been offered those in the past, and you may have chosen not to take them because there are more side effects. Things like methotrexate and cyclosporin. There are some new pills, and these are some of the medicines advertised. And those are things you take daily, and their safety profile is a lot better. And some people choose them because they don't like shots primarily. And then the next category are biologic medicines. And these are also the medicines that you see talked about more recently. And actually, they've been around for quite a long time, since the early 2000s, 2003, 2005. And we just keep getting more medicines in this category. Whenever we bring up injectable medicines, I always get a concerned look from patients. But I tell you, it is very easy for us to teach you how to give these shots, and patients give them at home, anywhere from every 2 to 4 weeks, or in some cases, every 3 months. For people, I have really had patients have their lives totally changed. Tears in the office. This is why I love doing what I do, because for people who've had this condition for decades, now to take a shot every 2 to 3 months and have almost no psoriasis can be just life-changing.
I love that. Thank you for giving us such a good overview on all of the treatments. To close this out, let's talk about some of the impact. I would love to hear some more of the impact of both the disease and the treatment, because you have definitely seen a lot having worked for the Psoriasis Center. And I think some of our listeners will really resonate with it too.
Yeah, I think so one seed just to plant in our minds, that something that's a little bit newer, is that we used to say that psoriasis is only the skin, or psoriasis is skin deep. And what we know now is that does not seem to be true. Just like we're learning about all sorts of other diseases, we are learning that psoriasis, this condition of inflammation, actually makes some other internal medical diseases more common. And that's,
Cardiovascular is the one that I've mainly heard of.
yeah, yes, exactly. So that's one. We've known for a long time about arthritis, and most people with psoriasis know that's a possibility. But cardiovascular disease, what's called metabolic syndrome, high blood pressure, these are things like obesity, diabetes, high blood pressure, kidney disease, heart attacks are slightly more common in patients with psoriasis. And people who have more severe psoriasis, a little bit more common. What I tell people is we don't have to freak out. We just have to be smart, right? What that means is if I have a 32-year-old man coming into my office with psoriasis, I'm going to treat their skin, and I'm going to be sure that they see their primary doctor and basically have the screening to say, even though I feel great, is my blood pressure okay? How's my cholesterol? Because those are things that if we identify them, we can treat them, and that we just need to be aware that those are things. Before we move away from this category, the other really important thing to know about is that depression and anxiety are more common. And we're not exactly sure if that's because of some of the chemical inflammatory changes, or if it's because of the appearance of the skin. But it is really important to know that that's not your fault. It's just something we see with this condition. And we want to both treat the skin disease, but also ask about that. And if there's some depression, or if it's really changing your life, or you're missing school or work, we want to be aware of that and address it.
That's interesting because that is true for a lot of the both immune mediated and autoimmune diseases, right?
Yes.
And I think, you probably will agree that in the next 10, 20 years, we're probably going to know a lot more about the exact mechanisms by which all of that possibly happens, just as we're learning more and more about the body, the brain,
Yeah. No, I agree.
all of the mechanisms.
One of the interesting questions I think for us in this field is also not just what's more common, like what do you need to watch out for, but what if I treat people earlier with maybe one of those biologic medicines? Will we prevent heart disease, right? Will we prevent high blood pressure? How will it affect those other things? So right now, we have some indication in some studies that can happen, but we don't have an across the board recommendation. If you say, Dr. Letsinger, I don't really care about the way it looks. I just want to be sure I'm safe. Right now, I might not really pressure you to use a treatment, but in the future, if it's going to help you live 10 years longer, I might. So we'll have to
Right,
understand.
like we know with something like diabetes is we can decrease the glycosylation of all of your organs, it can really help. So it's that same thing if we can decrease the maybe inflammation or the immune mediated complexes or whatever is happening. Like that is the other thing that really popped in my mind is I am not a huge fan of the Kardashians, but Kim Kardashian is obviously one of the most famous people to have come out, and I think her mom has it too, with having psoriasis. And of course, in her world where beauty and desirability is everything, I can see how that would have a huge impact. It seems to be wonderfully controlled and treated, of course. But for all you Kim Kardashian fans, first of all, don't hate on me for not loving her. But I wanted to bring that up because it does not discriminate based on, like you said, it affects all races, all genders, all.
No, agree. And I love it whenever I see people being real, and especially someone like Kim Kardashian, who you're right, I'm not her biggest fan, but I love that she's not just airbrushing that out, because this is something that is super common. And yeah, there are a lot of celebrities who have just come out and allowed that to be seen. And whether it's, I forget the guy who has arthritis, there's a lot of us out there, right? If it's 4 out of every 100 people, there's a lot.
Right. I think Leanne Rimes is another one, the country singer who's been pretty vocal about her psoriasis. But yeah. So, well, I think this was awesome. Thank you so much for taking us down the road to psoriasis. I think my biggest takeaways are that, like a lot of things, this happening can happen to anybody. And it's actually really encouraging that we have treatments, right? And like Dr. Letzinger said, you're right, your family doctor can absolutely get you started. And one of the more common things, and especially if you live in a place like where I live, where we call it a little bit of a dermatology desert, meaning physician dermatologist, you'd have to travel. It's totally great for them to start you, but also know that if that doesn't control your symptoms, there are different classes of medications that people that specialize in this disease can absolutely help you improve not only the appearance of your skin, but your quality of life and potentially also your longevity by helping sort of, potentially decrease in the future some of those other associated conditions.
Yeah, I'll just give one point of information. I really like an organization called the National Psoriasis Foundation. I'm not associated with them in any way. I don't get paid by them. But they are patient run, and that is a source that anyone, anywhere can look up to get really good information on everything. Things we didn't talk about, questions about diet, right? All sorts of things about psoriasis, the current medications, tools for families. That's a really good group, and it's www.psoriasis.org. That's a place you can go if you are in one of those places where you say, gee, there's not a dermatologist for 100 miles. So you can learn.
Yeah, I love that. Thank you so much. And as I close this episode, I know you do some amazing things. So, patients that are in the California area that you are located in, I know you actively practice. Where do you practice, especially as we have listeners from all over?
My practice is in Palo Alto, California, in the Bay Area. Yeah, Palo Alto Medical Foundation. I love psoriasis, as I said. We're all pretty busy, but I will typically make space for people with bad psoriasis, especially if it's something that they've seen other dermatologists about or other doctors, and they want to learn more. And there is a big group of people who like this, who can treat this. And I agree with you. A lot of people do great with treatment that their primary doctors might start, right? If we think that most people are mild, most people may not need all of the stuff advertised on television. Yeah, just know that we're here for you.
And I know you also coach. You have a boutique coaching practice. At some point, we're going to have a sort of more coaching-like episode. I just want to give you the floor to really close out with anything about psoriasis. And also, if people really felt like drawn to you as a person, what do you do as a coach? What is some of the other things that you're putting out in the world?
Yeah, this is a newer part of my practice. I'm really excited about it. Up until this point, I have coached just in a local way some doctors who are working with just figuring out how to enjoy their lives and how to continue practicing as a doctor. So I think about physician longevity. But the other part that is interesting to me is coaching patients and people who have some of these long-term skin diseases, how they're going to manage, not necessarily as their doctor, because I may not be their dermatologist, but how they're going to integrate this condition in their lives and how it affects them stepping back from a larger perspective. That's a part that I'll be adding, and we can talk about that soon. But I think I love my job. I feel really fortunate that I'm able to trusted and able to impact people's lives in this way. And I think, yeah, I'm thankful for being here, Dr. Borger. So thank you.
I am so glad that you are here. We're going to link all of Dr. Julie Letsinger's stuff in our show notes. Again, thank you so much for coming on to talk about this important topic.
Thank you.
Thank you for listening to the Aesthetic Doctor Podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.